So, hey, Monique, how are you?
Hi, Cliff. How you doing?
I'm doing well, keeping busy, and I'm so glad you're taking the time to sit and to do this interview with us. Um, just to introduce you to the viewers out there. I understand that you've been in the healthcare industry for over about 25 years.
hmm
Tell us about your career.
Okay. Pretty much, I've been an LPN since I was 18, an RN, registered nurse, excuse me, since I was 21. My career is pretty diversified. I've spent considerable time, about 5 years, working with the HIV/AIDS care population. So it's kind of similar to this pandemic and what I encountered when I first started. It was in the 90s when the whole pandemic for AIDS started, but it was definitely not as graphic as this pandemic. And then, through the course of the years, I've done about 10 years in critical care, cross-trained across all spectrums of critical care. I've done about 6 to 7 years worth of field nursing, community nursing, comprised of working for the New York City Board of Ed, working pretty much as a home care nurse, a home care educator, pretty much moving into um, doing quality management, utilization management. I spent about a couple of years doing that, specializing between the critical care area and the emergency room. I was the quality officer for those areas for a few years. And then now I am in case management for the last 7 years, inpatient case management. So pretty much this has been my current job. I've been a critical care case manager, emergency room. I floated around for a few years. And then our hospital opened up the brand new state-of-the-art 18-bedded orthopedic institute, in which I am the case manager for the new orthopedic hospital at my institution. That is
Awesome,
temporarily on pause.
awesome. So a lot has been your career has evolved, and
Mhm.
I guess it prepared you for this current pandemic, this COVID-19 coronavirus pandemic. And tell us about how your life has changed since then.
Prepared. I don't know if the word is prepared. I guess in terms of season, in terms of my clinical practice, yes, I'm prepared. I think emotionally, I'll be quite honest, I'm just as humane as everyone else. I was not prepared. you know, uh, in the beginning, like I said, the Orthopedic Institute result is temporarily on hold because no elective surgery, no elective surgeries during this time, and our ICU had to be extended by 12 more beds that took up pretty much 3/4 of the Orthopedic Institute because we currently have a 16-bedded ICU unit before the pandemic began. But because of the nature of the influx of all the people coming in and all the quantities, all the amount of people that needed ventilators and ICU beds, we did not have the capacity. So we had to pretty much open up our orthopedic unit to accommodate 12 ICU extra beds, which still wasn't enough. And pretty much the first couple of weeks, the first week and a half, I still remained up there as additional support resource because there's a lot of new nurses, so this was additional resource to the new nurses on the unit. Still acted as a case manager. A lot of patients came in with partial information, and due to the high acuity of the illness, the mortality rate was very high. We had about 4 or 5 deaths a day just up there alone. And, it's very hard when families can't come in because there was a no visitation policy. But then families needed to be kept abreast of what was going on and having some kind of connection. So there were times that I, as a case manager, I had to call those families, kind of fill in the blanks in terms of accuracy of, the family dynamics of the patient, pretty much the home environment of the patient, because we did have some successful cases that did go home. So we had to make sure we educate the family to make the provisions in the house for them to come home as well and observe quarantine without, subjecting unnecessary exposure as much as possible to their family members. And there are some patients that, went left and, went unfortunately past, and we want to give the family that connection. So we had to, we use our personal phones and create a FaceTime connection so that families as much as possible under the circumstances, had closure.
Right. That is awesome that you'd be able to provide that. That is so important. Monique, your job seems, it makes me sad, but at the same time, you're there helping. And, for those who do make it, we want to thank you for your service. And tell me how this, during this pandemic, how has it changed your life?
In the beginning, I was mortified. Because all I could think about is myself, mortality looking me straight in the face, survival. First couple of days, I literally had to check out from work to catch myself because I'm not good for my colleagues. I'm not a face of confidence for the patients that are going through this. And it took me about 2 days home to kind of regroup and get my mind ready to say that I have to return, and this is I signed up for this career. I love my career, and my faith in God, and my faith in God, and combined with my confidence and practice, and my work family is my second family at home. So if they're out there putting themselves in danger, every day doing the best they can professionally to keep themselves safe, to provide care for others, at least I know I'm not there alone. I'm there with another set of family, which is my work family. So that kind of smoothed things out a little bit to restore, a stronger faith that everything is going to be okay. We all were in it together. So, we had our moments of crying and bouts. I've actually had a coworker that kind of went under. And, at that point, I had left the unit because the facility my administration at my facility had appointed me to be the crisis transfer nurse, the evacuation nurse for our facility, because our facility was so compressed with so many patients and no place to put them. It was an unsafe situation. We did not have enough ICU beds. We did not have enough beds in the regular floors. And so therefore, I was the liaison for my facility with the U.S. Army for the Javits Center and the USS Comfort. So in that phase, the sadness and the fear, it slowly dissolved, because it was like, we got options and we got to get on this. We got to decompress. We got to save our colleagues from being burnt out. We have to minimize our colleagues' exposure, but we also have to maximize patient safety. And then there's hope, because now we have, lucky for my facility, we work in the health system. So there were other areas of other facilities that were not hit as hard as us. So that connection was there, where they opened up ICU beds, and it was allowing me to utilize logistics to save patient lives, being by the fact that we didn't have the resources, and get them out east or get them into Manhattan in our other system facilities to occupy empty ICU beds that they really, really needed, especially ones that were in emergency room rated, and we didn't want to risk that they never got to that ICU bed just because they were here in the emergency room too long. So the whole Javits Center project with the USS Comfort and our system support with other facilities, allowing our hospital utilized through me to get them to patients to the right place, to get them the care they needed in the most efficient time possible, to increase the best outcome, so we can have, as much people go home as we did lose patients along the way, but we also had a lot of successes, and it really boosted staff morale when we were able to get to a place where we can manage what we were working with, and knowing that we had support outside of our building that took off from us, and that made us feel better, knowing that we couldn't do it all, but there was other professional resources around us that took the burden off, and they were doing what we were doing. So we got better outcomes for the patient, So I don't know if you understand what I'm saying, but
I
that right
do.
away just took my emotions, took my spirituality, took my confidence to another level, because there were options in a time where a pandemic, this particular virus, we don't have no concrete understanding of how it operates,
Yes.
on what kind of preventative measure can be done to reduce the severity or to bring down the mortality. We have all these unknowns, but the known factor in a very, very great time was that we had support to get patients to the right place at the right time to get the services that they needed for great outcomes.
Fantastic. Monique, you are a phenomenal woman, and you're doing this all as a single parent, raising two beautiful girls. And
Thank you.
and you're making it happen. So how do you see this going forward?
The pandemic, I see, I'm a little fearful right now, only because there is nothing concrete, once again, about a vaccination, about, like how influenza has, vaccinations. And then even if you get the vaccination, doesn't guarantee that you wouldn't get the flu. But if you did get the flu, maybe the severity of how bad the flu would affect your body would be lessened because you had that vaccination. Or if you had the flu and there's medications out there. There's this medication called Tamiflu, for instance, that you would take to kind of, as long as you catch the flu symptoms early enough, that can reduce the severity, can drop the transmission level, meaning drop the infectious level of it so that it's not easily pretty much contracted by other individuals in close proximity of you.
Right.
COVID-19 has not identified that medication yet. They are in process of doing different trials, especially at my health system is doing some certain trials with certain antiviral medications, but nothing is concrete yet. Antibody testing has started. I actually had my test done yesterday. I'm waiting for my results to see if I have antibodies or I don't. I can't even say which one I would prefer because, like I said, we just don't know what this disease is 100% all about to guarantee what having antibodies means versus what not having antibodies means, Right. So we just hope and pray for the best for everyone going forward. I just see a couple of months of people getting restless at home wanting to get out, but I just can't emphasize the people enough. Please, I understand you have to get out. You have to get things done. Please wear your face covering, your face mask. Please wash your hands. Just understand that this too shall pass. We've had Spanish flu, we've had swine flu, we've had SARS, we had HIV/AIDS, and now we have COVID-19. And like everything else, this too shall pass. But everyone needs to adhere to social distancing. It is still unclear how it's transmitted, but there are still high levels of contractability of the disease. Even though the mortality amount has dropped, there's still a considerable amount of active infections going on outside. And I just pray that we can get to a place by the middle of summer where there's some tentative treatment available, that if we do encounter a resurgence in the fall, that there is some agent, whether it's plasma infusions or something that people can take to reduce severity so that we don't have to experience the trauma of all the mortalities that we have dealt with within the past couple of weeks.
Yes, we are so hopeful that this antibody or whatever you can give us to prevent it, or to, like you say, to lessen the
severity, lessen the severity
of
your
the
body.
symptoms. Yes, we hope that we can develop that sooner rather than later. Mm-hmm. Now, also, so how do you feel? I don't know if you know. No, I'm sure you know that your church, First Presbyterian Church in Jamaica, has opened up a testing site on our campus.
Yes.
How proud are you about that?
I'm very proud. I tell people all the time. Matter of fact, the Javits Center project has closed. That was a 7-day-a-week operation for 4 weeks, but now I'm back upstairs and I'm back in the ICUs, and I'm going back talking to those families again, trying to be that liaison between that patient that can't see their family members and the family members. They have these questions about testing sites, and they live in Queens, and the first thing I tell them is about First Presbyterian Church, and I give them the address, and I tell them to go on the website and read up more on information and set up an appointment and go. Everybody has a right to test, and some people, the hospital where I work at is actually on Long Island, but it's an influx of a lot of Queens residents, and they feel intimidated by going out to Jones Beach out east. And I say, look, you have one right here in central Jamaica at the First Presbyterian Church. And, also, I also advise them to also look at New York One, because New York One also has other testing sites. But I definitely am proud to know that I'm a member of a church that is helping the community in such a place where people are so overwhelmed and have limited resources to get to testing, and the church is in a central area where it's easy to get the testing done. So kudos to First Church, and kudos to Queens. We're the epicenter, but you know what? We're taking control of the situation. We're taking control, and First Presbyterian Church is right in the center of that, and I'm proud. I'm proud to be a member. Yes.
Oh, awesome. Yes, me too. Let's talk about how we celebrated your baby's birthday. It was so special.
Okay, you get me so emotional because, she was supposed to have this party like on April 26th, a nice fairy tale Sweet 16. And, and that earlier that day, she was very emotional because she said, that same week she was supposed to perform at the pen relays, right? And so all of that pretty much was canceled. But what was hurting her the most was that she felt like it's okay that the family still call in and gave her support for her birthday, but what's more important than a party and pen relay, what's more important is that she wished she could have been in a place where she could see everyone and just have people around her for her birthday. And little did she know, it brought tears to my eyes, but I had to fight it back because I didn't want her to know that I had set up a surprise motorcade later on that day to come and celebrate her birthday. So pretty much that was probably around the 1 o'clock hour when she had that misty moment. And then at 5 o'clock, 5:15, there was like a 20-car motorcade that surprised her. I made her think that her uncle was outside bringing her cupcakes, but instead it was like a 20-car motorcade coming through with music and fellowship and everybody waving with their masks from their cars, happy birthday. And some people pulled over and they just gave her tokens of gifts and affection in terms of, things for her to walk back in and savor the moment. And she said, to be quite honest, I know that I didn't have my party, but this still was the best birthday ever. I will never forget this birthday in my life because everyone left their homes and they came through to celebrate me. So much that the neighbors came out and I felt so special. I don't even know if a party could make me feel as special as I was feeling that day when the motorcade came through. Yes.
Okay, fantastic. So now you can save yourself some money. Maybe you don't have to
I wish.
have a party.
I wish.
Let's also talk about your 93-year-old auntie.
Yes.
During this season, we went over there to visit her, and she is so protective that when we got to the door, I was bringing her groceries, and I wanted to open the door, and she just sprayed Lysol at me. I closed that door so fast.
I heard. I spoke to her that night. I called her because, the Javits Center was still running. So I was still stuck at work doing logistics. So I couldn't make it to that motorcade.
Happy birthday to you.
Is she coming to the door or
what? Hello, darling.
And we spoke. She was so elated. She was on cloud nine, but she's better. She's better at 93 years old with wits, better than a lot of people out here in terms of adherence to the disease. I mean, she had it down packed. She sprayed you down with Lysol when you came to the house because, she can't be getting it because, she's exercising.
That's right.
She's the poster child for exercising, social distance, but enjoying it and then keeping you all outside on the porch, set up with everything. And she stayed inside within her glass door and enjoyed it and take pictures through the glass door. Aunt Tina, she just tickled me when she told me how she allowed you to celebrate her, how tickled pink she was receiving this love and attention and celebration for her 93rd birthday. But she did not fail to make sure that you all adhere to social distancing in doing so.
That's right. She did her way, and it was an honor to celebrate her in any way we could. So yes. Monique, I'm so glad you take this time to do this interview, and you have given us a wealth of information, and I'm so glad that you are of service.
Thank you.
So
I'm glad to be here. Thank you for having me.
And so is there any final words that you would like to part with?
Please, everyone, I love each and every one of you. I miss fellowship. I know my career limits how much fellowship I could get in person. I enjoy the church services online. A lot of times I'm at work when it's happening. And I say, everyone, just please be safe. emphasize hand washing, face masks, social distancing. And I look forward to seeing my church family in the fall when it's probably be safe at that time for us to regain, reconnect in physical fellowship.
All right.
So please be safe.
All right. And thank you so much, Monique.